This is the final perfusion and cardiac dysfunction video. So moving on, acute rheumatic fever. This usually happens after a strep infection. It's kind of a systemic response where they get carditis, arthritis, and chorea. That's that uncontrolled movement. This leads to chronic and progressive damage to the heart, particularly the heart valves, particularly the mitral valve, right? That left AV valve. This is something we don't see often in the United States, but it's a big problem in developing countries where strep throat is not treated as aggressively as we do here. A child who has this usually is treated after the initial infection. They're just treated with injections of penicillin every month. Kawasaki disease. This is acute systemic vasculitis. We don't really know why. So vessels, blood vessels swell, particularly the coronary arteries. Most kids, it happens between 6 months and 5 years of age. Starts acute where they have a high fever that really doesn't respond to antipyretics. That lasts at least 5 days. Then subacute when the fever finally ends until all of the signs are gone, and then convalescent until everything is resolved and all the labs are back to normal. 6 to 8 weeks there. So with Kawasaki's, the symptoms we're looking for that fever, conjunctivitis, a red strawberry tongue. They get some swollen lymph glands and a rash. The palms of their hands and soles of their feet swell and then peel off. So desquamization of the palms and the soles. And these kids are just miserable. They're they are miserable and they act like they're feeling miserable. The treatment for this during that acute phase, we're going to give intravenous immunoglobulin and high-dose aspirin, right? And you've been told over and over, no aspirin to kids. This is one of those exceptions. No aspirin to kids with viral infections. This is not a viral infection. It's probably some kind of an or autoimmune thing. So high-dose aspirin during the acute phase, and then we keep them on low-dose aspirin just for that antiplatelet effect until we're sure the coronary arteries are doing fine. And they will do an echocardiogram on this kid probably yearly for a few years to monitor the coronary arteries. If we treat this aggressively during that acute phase, these kids do just fine. If they have coronary artery damage, that does not go away. So as long as we can prevent it, they are just fine in the end. Preoperative assessment for kids going to surgery, right? We're going to do temp. We're going to do weight. We need to know. We're worried about possible infection, right? We need to know what they start at. We need to know what their weight starts at because we're worried about fluid retention, right? Edema. And then we're looking at all those things for perfusion. So peripheral edema, clubbing, peripheral pulses. I would say cap refill should be on there too. Color and temp of the skin, auscultation of the heart. We need to know if there's any change, right? So we need a good baseline. Baseline may not be normal, but we need a good baseline of what's their normal rate, rhythm, heart sounds. Are there murmurs? Are there clicks or rubs? A lot of these, right, we're worried about fluid backing up, that parking lot of the lungs. So we need a good respiratory assessment. Where did they start? What was their respiratory rate, work of breathing, breath sounds? Psychosocial. Make sure we explain what's going to happen to the child and use language that they're going to understand. When we use scary words, they assume it's something terrible. Allow the parent and the child to voice their feelings and ask questions. Make sure we have enough time to answer those questions and concerns. We don't want to rush through this. And then encourage the parent and the child at the child's developmental level to participate in their care as much as they can. Parent teaching. We want to make sure they really understand the anatomy and what the defect is, what is going to happen before the surgery. Make sure they know where the child's going to come out so they're not freaked out when they see the ICU, what the child's going to look like, what tubes and things they're going to have, where the incision's going to be, what the dressings are going to look like, what the child's allowed to do or not do after surgery. And let me just say, any kid who's had heart surgery, you cannot pick them up under the arms. You've got to scoop them from under the bottom and the back and lift them that way. We don't want to put pressure on that sternal incision there. So what nutritional restrictions? They may be on fluid restrictions. They may need formula that's fortified with extra calories. What medications? What's the schedule? How much of each? Let's make sure they've got syringes marked for the right meds and the right dosing.